Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPARS. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganon-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera, siguro mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo, kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. Ay, Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
Father ko muna, start ng take ng PPARS vial para po sa prostate cancer niya. Kasi medyo malala. Ang putla na niya medyo nakakatakot na. So, while taking PPARS, little by little, yung pamumutla niya nagre-reverse. Namumula na yung pisngi. Nakatulong din sa appetite niya. Din syempre sa sa bowel movement. Kasi mukhang isa yun sa na-paralyze other than his legs. Sa lab test din, pati yung mga red blood cells niya nag-i-improve na. And yung mga SGPT, mga cholesterol, nag-i-improve din. Then sa energy levels din, kahit na bedridden siya, makulit. Since maganda yung effects, Mother ko rin pinag-take ko. Kasi siya naman hypertension, na vertigo rin siya dahil sa hypertension niya eh. So sa kanya soft gels lang. Yun, ganun din, maganda rin. Nag-i-improve din alongside ng maintenance niya yun, yung PPARS products. Then all in all, maganda naman. So, syempre, since nagandahan kami, di ako rin. Nakabawas sa stress, nakakasarap ng tulog, mataas din energy. So, ganda. Ganda eh. So, super recommended eh. Ganda nga eh. Kahit headache lang o paghihilo na babawasan, super recommended.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi gito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya. By accident. Right foot niya, may para siyang matangisda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So hindi niya na nararamdaman na minatapakan pala siya. So probably yun siguro yung nangyari. Minatapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So nagkaroon siya ng lagnat on and off, nakahiga lang siya. So sabi ko sa kanya, so anong plano mo? Sabi ko, pa-check na natin yan. So pina-check namin as OPD, chinek, binigyan, niresetahan ng gamot, tapos tinignan yung sugat, binusbos. Pero kapiranggot lang ang tiningnan. Tapos in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka pamamaga niya, lumaki lalo. So sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So yun ginawa namin, twice a day kami naglilinis, tulungan kami ng husband niya, hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya, sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung mo na ako binayaran eh. So it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, yung lalo na yung wound healing. Yun yung nakikita ko yung wound healing talaga. Nag-granulate siya, na gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? Dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titingnan mo naman yung long-term na gamutan, mas mahal yun. Tsaka hospitalization. At yung, syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti, nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
We're always with you from start to finish.
Good day, everyone, and welcome to another episode of Simply Nature Answers. We're thrilled to have you with us today for this exciting wellness series where we'll provide worthy insights and answers to the pressing health-related questions. And we are an international distributor of food supplements derived from a unique strain of microalgae known as PPARS, which has been tried, tested, and certified proven to support not only cancer treatment, but also enhance general health and reverse metabolic syndromes like hypertension, diabetes, and high cholesterol. So if you've been curious about how Simply Nature PPARS products can make a difference in your health journeys, you are in the right place. I'm Sheila, and I'm your host for this afternoon. We're excited, really, because today's SNA topic is entitled 100% Natural Solution for Cancer from a Doctor's Point of View. As medicine evolves, many doctors explore natural solutions alongside conventional treatments to enhance positive outcomes. Simply Nature PPARS, a 100% natural plant-based solution, supports cellular repair, immune modulation, and chemoprotection. Understanding its science empowers both doctors and patients with a holistic, evidence-based approach to better health. Throughout the webinar, feel free to send in your questions by dropping it on the comment section. We'll be answering as many as we can during the AMA session at the end. So please don't hesitate to throw in your questions and engage with us. All right, for the questions today will be answered first, of course, by our resident pharmacist, our one and only dearest client service officer here in Simply Nature. I'm sure you know her, Ms Jen and of course, she will be joined by a successful entrepreneur and a seasoned international speaker on a wide range of topics, ranging from personal success to healthcare. He is the CEO and founding director of Simply Nature International and passionate advocate of integrative health solution, Mr. Shyan Lim. Now, leading our discussion for today, it is an honor to introduce our distinguished speaker, Dr. Maria Azores de Castro. With the expertise spanning conventional and natural medicine, she holds a Doctor of Philosophy, a Doctor of Dental Medicine, and Doctor of Natural Medicine, alongside her specialization in traditional and holistic medicine. Dr. Joy is deeply committed to integrating natural healing solutions with modern medical practices, empowering both practitioners and patients with evidence-based approaches. Today, she will share her insights on Simply Nature PPARS and their role in supporting health immunity. Let's all watch this. Good day, everyone. I'm Sheila, and welcome once again to another episode of Simply Nature Answers. This series are programs that will let you know much more about Simply Nature PPARS. And today we are very honored to be joined by an amazing woman, amazing doctor, all right? She is Dr. Joy Maria Azores de Castro, a certified naturopathist from Infanta, Quezon.
Yes, good day everyone. I am Dr. Joy Maria Azores de Castro, a certified naturopathic from Quezon Province. I am the owner of that wellness center, the first accredited wellness center of the Department of Health of PPAC.
And the
Diba?
pioneer.
Yeah, the pioneer. So I am proud and I'm very thankful that Department of Health and under PPAC trusted me to open a wellness center in that province.
I know bakit po ninyo ginamit noon yung PPARS and para saan po?
I was recovering from cancer, ovarian cancer, and my doctor and my oncologist told me that, Doktora, 2 months to live. So what kind of supplements do I need to take? I know it's not an accident when I first met the Simply Nature, especially the PPAR tablet. So that time, Jocelyn told me to take it. Sabi ko, anong content ng PPARS? Bakit siya? She just told me that it is cellular food. Cellular food, meaning everything in our body will be repaired. And I know the body will heal itself that time. So that's I think almost 10 years ago. 10 years ago.
Wow.
Imagine yung bigyan ka ng taning ng doktor na 2 months to live. Tapos how long na?
No,
Di ba?
yes.
How long? It's a blessing from God. And I know God has a best purpose for me. Kasi dentist din po ako, orthodontist po ako. Orthodontist, my husband, my eldest is also a dentist. Pero dinala niya ako ng mag-aral ng metabolic medicine, ng natural medicine. Tapos doon ko naintindihan na ang katawan pala ng tao ay nare-repair, nagre-regenerate, and nagre-rejuvenate using the best supplement and changing your lifestyle 101% and connection to the best doctor, our God, our
Amen.
Lord
Amen
Jesus
to
Christ.
that.
Diba?
Amen.
He is the best healer. Nung time na nalaman ko na may cancer ako, akala ko end of the world na. Yun pala hindi. Yung lahat ng mga makakarinig nito na if you have cancer, ilagay nyo lang sa isip nyo na you have trangkaso. Trangkaso, simple disease na madali siyang gamutin. Madali siya. Pero kailangan mo talaga ng change of lifestyle,
Yes.
best supplement, best cellular food. Kaya nandito yung Simply Nature. Ano ba yung PPARS? Proliferator, activator, receptor. So, ina-activate niya yung metabolism ng body natin. Nire-repair niya. Nire-repair niya. Napakaraming supplements. Pero, iba ito eh. Iba talaga sa lahat ng mga supplements na na-try ko. And until now, ito yung pagkain ng family namin. Every day. Imagine, my mother is 96 years old. 96 years old. She's taking PPARS every day. 5 couplets in the morning, 5 couplets in the evening. Diba? Minsan nagtitipid pa nga. So, dapat talaga mas madami. Kasi pagkain yan eh. Because of changing lifestyle ng food at saka yun nga cellular food, tinitingnan ko sa mirror yung katawan ko, yung itsura ko. Mukha ba akong nagde-deteriorate? Diba? Hindi gumaganda, bumabata, lumalakas.
Amen.
Because of the good effect
Of
ng
Simply Nature.
ng Simply Nature, ng PPARS. Talagang hindi mo siya bibitawan. Magiging part na yan ng everyday food mo. Kasi pagkain yan, Sheila. Alam lang nila, mag-take ka ng PPARS tablet kasi may cancer ka, di ba? So, PPARS is not just for curing, for treatment, but it is for prevention. Kasi madumi na yung paligid natin. Ang pagkain natin na healthy foods.
Toxic
diba?
residues, yes.
Correct. Ang dami ng preservatives.
Yes.
Kaya ngayon ang daming, bata pa lang may cancer na. Bata pa lang nagda-dialysis na. Bata pa lang ang taas na ng sugar. Everything is abnormal. So, pag nagtitake ka niyan, balanse. Balanse, mayroon kang panglaban. Ang Simply Nature, part na yan ng pagkain natin everyday.
I agree.
So, pagkain talaga yan. Di ba?
Why are you always including PPARS din sa mga recommendations niyo po sa inyong mga pasyente?
Kasi for me, perfect cellular food. Good for body metabolism, good for repair, good for regeneration, good for rejuvenation of our immune system. Kaya, hindi mo siya bibitawan. Lahat ng pasyente na may sakit, lahat ng pasyente na merong abnormal diseases, meron siyang hindi maganda sa sira ang metabolismo. So you need to give a good cellular food. Diba? Talagang cellular food yan eh. Cellular food. Tapos doon sa mga may cancer, para yung mga sinasabi ko na pang-ultimatum, better to take the vials, the liquid form, because it easily absorbed.
And highest concentrated form also po. For Doc? For example, mga diabetic patient, hypertensive patient, ano usually yung recommendation niyo sa
Okay, nire-recommend ko. Gusto ko ma-reverse. Kasi diabetes is reversible.
Guys,
Especially yung type 2 diabetes. Kasi yung chronic diseases, yung lifestyle, based on your lifestyle. Diba?
totoo yan, Doc. PPARS has may clinical studies, that's why. No?
Oo, naman.
Ano yung nagpabilib sa inyo about Simply Nature PPARS dun sa mga clinical studies niya?
Yung sa mga clinical studies, hindi na ako tumitingin dyan eh. Tumitingin na lang ako dun sa magiging good effect ng pasyente ko. Kasi imagine, stage 4, yung manggagaling sa hospital dito sa Metro Manila, pupunta sa akin, yung parang dying, crying, all families are crying, asking for my help, asking for miracle. So, hindi naman po ako magician. Sabi ko gano'n, hindi naman po ako magician. Ginaganyan ko sila. Pero, meron po tayong alternative way. Nasa 5 vials pa lang ang natitake. You will see.
Wow.
You will see the goodness ng pasyente. Yung tipong masaya na siya, kumakain na, nakakainom na siya ng water. Doon pa lang. Kaya, yung sa data, data ng pasyente ang tinitingnan ko, Sheila.
Yeah, the laboratories also.
Oo,
no?
yung
And solid
laboratory.
evidence.
Kunyari, ipa-check mo yung cancer marker. After a month, after 2 months, pag pina-check mo, kung i-base yung stage 4, nagiging stage 1 agad. Diba? PPARS na yan. Dapat yan ang kinakain ng mga may diabetes. O para yung sugar nila, ang pancreas, mag-secrete ng enough na insulin, mag-secrete ng enough na glucagon. So, walang abnormal. Wala. Quezon Province, maraming yung betel nut user, yung nagnganganga. So,
okay.
paramihan meron silang squamous cell carcinoma, yung may mga sugat sa bibig, may butas na yung mga dito.
I can imagine the pain,
May
Doc,
mga, sobrang painful. Hindi ka na makakain. Merong mga sugat dito, hindi na sila makanganga. Meron akong isang patient na ganyan na nagpa-check dito sa Metro Manila, sa hospital. Ang sabi sa kanya, kailangang operahin, surgery, ayaw niya. Kailangan niya i-chemo, kailangan mag-undergo ng radiation, ayaw niya. So, nung time na yon ay pandemic. Pandemic. Magpa-pandemic. So, mahirap.
Yes.
Napakahirap.
Yes.
Paano gagawin? Parang accident finding. Nagdumaan lang doon sa, nakita niya yung signage ko na accredited Dr. Joy is a dentist. Pero bakit ngayon naturopathic practitioner? Parang na-amaze siya. So, nag-try. In-explain ko sa kanya. Explain everything. Na sabi, doktora, mamamatay na ba ako? Mamamatay na raw siya. So, hindi pa.
Sa status na siya ng gano'n talaga.
Yung parang stress na siya, depressed na siya, parang gano'n. Sabi ko, hindi. Kasi cancer is curable. May trangkaso pa lang. Nung narinig niya yon, yung kitang-kita mo sa eyes ng pasyente na nag-glow, na parang meron palang hope. May hope. Anong gagawin natin? Do ang naisip ko, kailangan nito ng vials. Vials na agad. Vials. Sabi ko, medyo expensive, pero mas mahal ang buhay.
Yes.
Di ba? Mas mahal ang buhay natin eh. Yung inaano nila, ang mahal. Tanungin mo nga, mas mahal ang sarili, ang katawan natin. Di ba? At ang pera nahahanap.
Yes.
So sabi niya, pwede ba akong mag-order agad ng 2 boxes?
Okay.
Sabi ko, actually, kailangan niyo po for 30 days na isang vial. Sabi kaya, i-observe muna. Parang trial and error. Kinoach ko na siya, yung lifestyle, yung food, everything. Sabi kong ganyan. In 5 days, siya yung nagsabi sa akin, alam mo, doktora, lumiit. Pinipicturean kasi niya yung,
that's
yung
very good patient,
Talagang documented, Sheila.
Yes.
Documented. Picture niya. Doktora, lumiliit talaga. Tapos, picture siya lagi ng picture. Naubos niya yung 10. Ang laki ng pag-shrink ng wound. Tapos yung second. Pero before that, nag-cancer marker muna ako. Mataas talaga. Parang stage 4 na yun. I-consider mo. Sabi ko, don't worry. Whether you are stage 1, 2, or 3, or 4, it's just a number.
Yes.
It's just a number. Sabi kong ganun sa kanya. Sabi, doktora, after ba mag-take ako ng second vial, pwede na ba ako magpa-cancer marker? Pwede naman, sabi kong ganun. From stage 4, naging siyang stage 1.
Ganun kabilis.
Ganun siya kabilis.
Grabe.
Ganun siya kabilis.
Inspired
Tapos
siya.
na doon sa period ng remission. Kasi 5 years, di ba?
You telling them that there's really hope, I think,
Oo.
napakalaking bagay po nun sa pasyente. Kasi napakabala
Kasi
niya blessing.
I know in my heart that cancer is really curable.
You've experienced
Yes,
it.
I experienced it. Another one is from a nearby town ng Infanta, colon cancer. Colon cancer. Yung pasyente dinala sa amin, sa kliniko, talagang dying. Dying, as in dying. Kasi blood na ang dinudumi niya, as in skin and bone.
Medyo iba din ang gravity.
Yung parang
Yes.
yung heart mo is
Nag-sunk din.
nagsak,
Yes.
parang ganyan. Pero, I know in my heart na humihinga pa tong pasyente eh. May pag-asa pa to. Sa awa ng Diyos. Recovered. Marami, actually marami. May liver cancer, merong ganyan. Breast cancer, yung nabigyan ko sila ng right protocol. And until now, ang maintenance nila, yung PPARS natin.
Yes. Thank you, Lord.
Sabi ko, for life na kasi yan, na kasama mo yan sa everyday food mo, everyday diet mo. Complete food. Complete. Lahat na ng vitamins, lahat na ng minerals, included. Included dyan. Kaya, for those who are watching us, especially yung mga may cancer, don't worry. You will be healed. Basta mag-partner lang kayo sa Simply Nature. Diba? Kasi we're here from start
To healing.
to healing. Oo. Kasama kasi yun. Kasama talaga. So, yun po naman na may diabetes, nare-reverse. Kasi marami rin na ang alam nila, once na diabetic, always diabetic. Diba?
Like
Hindi
forever.
totoo yun. It's not true. Kasi ang dami ko nang na-reverse.
Doc, I'm very curious. I know kasi she's one of the models of our vials. Okay. But
Every week.
yes.
Yes.
But do you also recommend our soft gel capsules and also yung powder?
Yeah.
Sa mga anong klaseng sakit nyo usually?
Especially yung powder natin. Yung mahilig sila na mag-blender, mag-juicing.
Yeah.
Yes, pinalalagay ko yan. Yun naman na mga soft gel, usually binibigay ko yan sa may mga diabetes.
Nice.
Oo.
Perfect.
Oo. Pero yung vials natin na liquid, talagang sa may mga cancer. At kung hihingin nyo sa akin ang datos sa mga pasyente ko na gumamit ng vials, they are 100% cured. Kumbaga, ang pera nahahanap Sheila eh. Pero yung buhay natin, isa lang yan eh. Isa lang. Kaya wag mong sasabihin na mahal, may paraan. Nakakagawa nga sila ng paraan para dun sa other treatment. Bakit hindi ka gumawa din ng paraan dito sa natural na mas malaki ang percentage ng healing?
Yes.
Ang chances ng healing. Mas malaki talaga. At marami na din ngayon ng mga doctors na they believe, ini-integrate na nila.
Amen.
Diba?
Totoo.
Marami na tayong doctors using PPARS.
Ang maganda dyan, Doc, parang kagaya din yun, medical doctor also.
Yeah.
Na who also believes and also prescribes our PPARS.
Correct.
Doc, at this point, no, before we say goodbye to our viewers, I'd like to ask for your quick message, no, not only to patients out there, but also to your fellow doctors and medical practitioners.
So, dun sa mga co-doctors ko or dun sa mga conventional doctors na they don't believe in natural way, pwede niyong i-complement yung natural. Pagsabayin, ipag-join. Kasi hindi naman threat. So, kung i-base natin yan sa datos, pag titignan natin ngayon, mas marami ang nagiging successful ang treatment sa natural medicine. Diba? So, yung hindi mo naman din pwedeng sabihin na iwanan niyo yung practice niyo, i-complement lang, i-integrate lamang. Hindi tayo threat, dapat tayo nagtutulungan para doon sa ikabubuti at ikagagaling ng mga pasyente natin. Let's open our minds na maging considerate. Na maging considerate din at i-integrate ninyo doon sa mga pasyente ninyo. And you will see, mas gagaling sila at mas hahaba ang buhay nila ng may magandang purpose at pasasalamatan kayo. Thank you po.
How about sa ating mga pasyente?
Ayun sa mga pasyente naman namin, lalo na sa Infanta, sa Quezon Province, yung mga pasyente ko na hindi ibig sabihin after 3 months, after 6 months na you are cured doon sa ating mga treatment. Lifetime po yan na tayo ay susunod pa rin doon sa mga ibinigay ko sa inyong mga protocol, doon sa mga guidelines. Kasi pwedeng bumalik. Pwedeng bumalik yung diabetes. Pwedeng mag-high blood ka ulit, Sheila. Or pwedeng magka-cancer ka ulit. Kung babalikan mo din ulit yung dati mong ginagawa. Diba? So, ang paggaling po talaga sa lahat ng mga sakit ay nasa sarili natin. Kami lang po ay nandito to guide you, diba? To guide you and to educate you and para mas mahaba pa yung inyong magiging masayang buhay. So yun. Good day, this is Dr. Joy Maria Azores de Castro, a certified naturopathic practitioner here in Infanta Quezon Province, who's been a partner of Simply Nature for almost 10 years. And I really trust that company because PPARS is a very good cellular food who heals most of my patients, especially those who has diabetes, who has cancer, and we are here from start to healing. Thank you, Simply Nature.
Wow. May I just say that that interview was actually very inspiring and very encouraging. I'm sure that a lot of you has got curious about Simply Nature PPARS and has learned so much from the discussion discussed by Dr. Joy Azores de Castro. All right. Now, but first, before we go to our questions, because we are now in the AMA or Ask Me Anything portion, I'd like first to greet our viewers for today, starting up with Ms. Noemi Veras, Mr. Marks Carl, Aldrin Beltran. I would also like to greet Ms. Nessie Ocampo. Hello po. Ms. Annabel Oxan Valencia, Vilma Valdez, Candio Rowena, City Manday, Ms. Short Kalalan. Hello po. Mr. Jack Way. There you go. Thank you so much for joining us today. If you have questions, as I can see, some questions are coming in now. Please don't hesitate to drop in the comment section. All right, now to answer your questions for this afternoon, that we call on our experts, the CEO and founding director of Simply Nature International, Mr. Shyan Lim, and our resident pharmacist and one of our caring client service officers here in Simply Nature. You all know her, Ms. Jhen Macanjola. Good afternoon, Sir Shyan, and good evening. Good afternoon, Ms. Jhen.
Hi, Jen, and hi, Sheila. So good to see everyone.
How's today?
Yeah, I'm glad to be back in the Philippines. I was actually traveling a lot during this month, first for Chinese New Year in Singapore and then Chinese New Year in Taiwan. So it's good to be back.
That's right. And welcome back, Sir Shyan. All right. Well, I can see a lot of questions coming in now. Shall we start, Sir Shyan?
Yes, let's go.
Okay. All right. So for the first question that we have here, actually, this question was requested by our client to be asked again today. All right. Because we are focusing on the Simply Nature PPARS as question. So question is, hello, I would appreciate if you could enlighten me about the iodine content in the Simply Nature PPARS products, specifically the powder extract, 10 scoops and 30 tablets that I've been consuming daily for 15 days now to help manage my multiple thyroid nodules. Are these amounts within the safe levels or RDA? Additionally, I'm concerned about the potential risk of excessive iodine intake, particularly individuals with thyroid problems. Thank you.
Okay, let's answer this question directly. Number one, among the products that you're taking right now, the extracts don't contain iodine. All right, the extracts don't contain iodine. The tablets do contain iodine, but that is really trace amount. That's really trace amount. So for any of the viewers out there who want to take a supplement with iodine content, actually Simply Nature products is not your ideal source of iodine because it's really very trace amounts. So now, why is that so? Okay, those of you who have iodine sensitivity, number one, you would notice that you usually try not to eat seafoods, definitely not seaweed, right? So even things like, the seaweed that they use to wrap for Korean food and Japanese food, yeah, you will want to avoid that. The reason is because iodine is usually oceanic in origin. So that means salt water, all right? So it's not naturally present in fresh water. So any product that is fresh water in nature usually does not contain iodine, or even if it does, it contains very trace elements of iodine. So iodine is naturally present in seawater in the form of iodide. Okay, so a bit technical here. So over time, marine life and seaweed especially will absorb iodine from the surrounding waters. Okay, so that is why seaweeds are one of the higher concentration of iodine if you want to find it naturally. So many people mistaken because products like ours, including products like chlorella and spirulina. Actually, chlorella and spirulina also don't contain much iodine or not at all as well. The reason again is all these algae are fresh water algae. That means our microalgae, chlorella and spirulina, they are actually freshwater algae. They do not grow in seawater. And because of that, there is very little or no traces of iodine in that. So for this particular viewer's question, this patient's question, you don't have to worry at all. Okay, there's not going to be any iodine built up in your system from the extracts and from the tablets. It's just trace amounts. And if you take a look at the tablets, if you're taking 20 to 40 tablets, 40 tablets is 4 grams. 4 grams of our tablets would not constitute any significant or measurable amounts of iodine. You know, Sheila, maybe we have to put a note in the nutritional content that we give to our patients going forward, right? We should put there really trace amount for iodine. Because this is a good question. Because there are actually patients who, for example, with goiter, they actually lack iodine. They want iodine. So examples, people living in Baguio, you will notice in Baguio, having a goiter is more common. The reason is because they live in a mountain. So they are very far away from seawater. So they don't have much natural sources of iodine as opposed to the rest of us. So I'm not talking about the city dwellers in Baguio, I'm talking about like the traditional natives of Baguio. Because when I went to Baguio many years ago, it was told to me that a lot of local Baguio people have, it's not so rare that they actually have goiters. So it's because their diet lacks iodine. Okay, so I hope I've answered very clearly for this particular viewer. No worries. Okay, and I want to make a clarification for other viewers. If you're looking for a supplement with iodine content, and you need iodine content, then Simply Nature PPAR tablets will never be sufficient for you. However, our products are really still very effective for people with goiter. So it's not because we contain iodine, it's because the other mechanisms of action in our product helps to actually reduce and remove the goiter. Okay, it's along the same mechanisms as how our product helps to remove tumors and growths. All right. Did I answer the question?
Definitely, sir. Yes.
Okay.
I think, may I just add, because her condition is actually just thyroid nodules. We've had patients with thyroid tumors supposed to be going for chemotherapy.
And I have patients with thyroidism. All right, so we're talking about this particular patient of mine is actually a friend of mine that I knew many, many years ago. She had hyperthyroidism, and she actually suffered from the symptoms of hypothyroidism because the medication that they give for a hyperthyroid person is to slow down their metabolism. So they actually become hypo. And because of that, because of their medication, they become swollen and fat, right? It is because of a lower metabolic rate. Now, this particular patient, a friend of mine, she took the extracts. So her personal experience was she went through what we would call Herxheimer reaction, which to a layperson's, what you hear from natural integrative doctors is healing crisis, all right? Healing crisis is when your body actually reacts to what you eat, and that's a good sign. So for her, she had high fever and weakness, so much so that she actually had to take sick leave. It lasted more than a week, about 10 days. But after that, her need for thyroid drugs actually, she didn't need the drugs anymore. And she lost weight, she went back to her usual self, and she wasn't hyperthyroid anymore. Of course, her condition, she was still very sensitive and kept monitoring her conditions, and she's careful about it. But yeah, she was basically able to manage her hyperthyroidism using PPAR extracts and staying off medication. So again, she managed to avoid the side effects of the medication, which is hyperthyroidism, which made her swell up and always tired and fat. All right, so I think, yeah, that's it. We can go to the next question.
All right, sir. Okay. So for the next question, okay, coming from Miss Jade, thrown to us privately. Question is, can PPARS help with loss of appetite during chemotherapy? Excellent question.
Definitely. I'll share the technical and maybe Jhen and both Jhen and yourself can share, right? Because you have many patients who are actually cancer patients that you support. Okay. Yes, definitely it will help with your loss of appetite. Loss of appetite is a very general term. So there could be many causes. The patient could be so tired they don't feel like eating. Okay, that happens to you. I'm sure if you experienced it before in your own life, be it from work or you just exercised a lot and you went to the extreme and you're too tired to eat. So if a patient is tired, then it affects their appetite. If they have discomfort because of the drugs, all right, affecting their GI, that may also cause for the lack of appetite because it disrupts their system and it disrupts the hunger signals as well. Okay. Of course, emotionally as well. If the patient is depressed, right? Some people eat when they are depressed, but the reverse is also true. Some people don't eat because they are emotionally not well. So chemotherapy does affect the patient's emotion. It can affect the emotion directly because of the discomfort going through. It can also be because it affects the gut microbiome, and your gut actually determines the emotional state that you're in. It's where your serotonin is produced, right? So if you're low in serotonin, you would not be very happy, you'll be very cranky and things, or depressed. So that might affect appetite. So we actually did a clinical trial on this. So what we noticed is that usually when a patient starts chemotherapy, they start to lose weight, and that could be loss of appetite. So with Simply Nature PPARS, especially soft gel extracts and above, they notice that the weight loss is mitigated. That means they don't experience much weight loss in the beginning. However, if you're going for like 8 cycles of chemotherapy, at some point, at the 6th cycle, 4th cycle, you will experience some weight loss because really going through chemotherapy can be very stressful on some patients. So just the stress alone will cause the body to burn a lot of energy, and that will result in weight loss. But it's much better when you're on the extracts than if you're not. All right. So it's in conjunction with your question about loss of appetite. It will also give the patients energy. So that's going to be good. It will also protect all your cells' mitochondrial functions. Okay, this is one of the key most important aspects of fighting cancer. In fact, there are new studies that show that if you can protect the cell's mitochondrial function, you can actually use that to fight cancer. And also it might also even affect the cancer cells also. That means if you can help the cancer cells mitochondrial function normally, it will cause the cancer cell to actually die. That might be one of the reasons why our product can cause cell apoptosis. That means the cancer cells die on their own, like what Dr. Joy shared in her interview, right? So, yeah, I gave you a long answer to a short question. Okay, maybe both of you can share your experience with patients.
Miss
For
Jen?
me, on a nutrition point, there's a lot of foods that should be avoided when you're a cancer patient. Diba? So we have the red meat, we also have dairies, and then they contain nutrients that it's hard to find in other sources. So good thing we have that in the PPARS tablets. That's why it's important to take it together with the extracts.
You know what Jen said is really true. One of the reasons why we take meat is because they have amino acids the body doesn't produce. So there's this group of amino acids called essential amino acids. When you go to the supplement store, you also buy that essential amino acids. It's essential because your body cannot produce them. All right, so you must get them from an external source, which is everybody's favorite source is beef, right? Your samgyeopsal and all your steak and your hamburgers, right? Well, the good news is that, well, that is not good for cancer patients eating red meat. Okay, so the good news is that you can actually get the full spectrum of the amino acids from Simply Nature PPAR tablets, not the extracts, because in the extracts we remove all this amino acids, vitamins, minerals. A lot of it is removed and concentrating only on a PPAR agonist. So take the tablets as Ms. Jhen has shared for the amino acids. Some of the nutrients is complete.
Excellent. Well, I just quickly want to add that this is a very valid question and entails a lot of a lot of patients not to really go through chemotherapy because of this scare of losing the appetite. But with Simply Nature PPARS, having it together with the chemotherapy could, you could be confident that the patient could still get the right nutrients during the journey. Reason why I've seen it with my son, may I just say this, that even during the chemotherapy was being done with him, and during the chemotherapy session itself, he was very energetic. He didn't actually lose a lot of appetite, but there could be a lot of factors in terms of losing weight. But in terms of the energy, I've seen it with my son. He's very energetic. Okay, so there. Okay, so for our next question, this question is interesting, coming from Miss Nessie Ocampo. Question, Sir Shyan, is what is the best way to take PPARS tablet? Is it by chewing it or swallowing it with water?
Okay, number one, the most important way is that you take your PPAR tablets, all right? Okay, that's number one. Okay, now, if you are talking about the best way to take PPAR tablets, it will be chewing it. All right, so you'll be chewing it. Okay, why? When you chew it, okay, number one, whenever you chew something, you promote your mouth to salivate. You will have saliva, right? Also, the saliva actually does help to break down the nutrition of the whatever you're eating. Next, as you chew it in your mouth, a little of it will go under your tongue. So what is under your tongue? Under your tongue, there is this channel where it's sublingual. That means your body absorbs it directly into the bloodstream. Not obviously, it doesn't go into your blood like that, right? But yeah, it's a faster, more direct channel where it will enter your bloodstream faster than going through your throat, into your stomach, and into your intestines, right? So that is why for Simply Nature PPAR powder extract, we eat it by putting it under the tongue. If you are drinking Simply Nature liquid extract, we always encourage our patients to swirl it and let it keep under the tongue to let some of it be absorbed directly into your system without going through your digestive tract. Okay. Now, another benefit is that it actually sort of whitens your teeth. I don't really understand how it does that. It might be because the PPAR tablets is alkaline in nature. Maybe it neutralizes the acidity of the food that you've eaten when you chew it. One thing I do notice is that if you have a toothache, this emergency hack, all right? If you ever have a toothache and you can't rush to the dentist, all right, and it's killing you because it's so painful, number one, you can ice. You will definitely be putting ice on that spot so that it won't hurt. The next thing you can do is you can actually chew PPAR tablets. It will actually reduce the pain. So I don't exactly know why it happens this way. But again, one possibility is that it could be alkaline in nature and it sort of reduces the acidity in your mouth and stop the attack on your tooth and the nerve, right? So that's one possibility. So the benefits of chewing it is better nutritional uptake, makes your teeth white. But the downside of chewing it is that your mouth would smell like algae. And it's a rather strong smell. And if you immediately speak to anybody, your teeth will look green, all right? Okay, so if you're at home and you're not meeting any guests, and you like the taste of the PPAR tablets, it tastes like green peas, like mongo. Tastes like mongo with a slight tinge of metallic tinge because of the mineral content. All right, then go ahead. Chewing it is the best way. Okay. But the downside is that your teeth will look green and you will have algae breath. So if that's fine with you, go ahead. If not, you can swallow it with water. Okay. Yeah.
Thank you, Sir Shyan. Would you like to add anything, Ms. Jhen?
Yeah, I just want to echo out the most important thing is that you take it.
Yes.
Preferably by chewing it is okay. Then second, by just swallowing it with water. Personally, I just swallow with water. But there's another thing, third thing, you can also crush it and mix into smoothies if you don't like the taste.
Yes, you can do that. Mm.
Yeah, may I just say some of the patients that are using the powder extracts actually takes advantage of taking in the PPARS tablet by swallowing it with water, because right after they swallow the tablets with water, their mouth is kind of moist. So it's the best way to put the powder right away or right after that. So there.
Yeah, that's a
All
good.
right.
Yeah, there's no absolutely. It's actually a good combination to take the powder and the tablets together. Yeah.
Exactly. Thank you, sir. Thank you, Ms. Jen. Next question. Coming, actually, this is kind of like a comment. So coming from Ms. Vilma Valdez, I'm now using the soft gel 2 times a day. Is this good for me and my polycystic kidney disease? As per my KUB, had large cyst on both kidneys, but no inflammation noted. Congrats. Cholesterol and blood sugar slightly elevated. Have psoriasis too in my back and hands. Thank you, doc, and for your guidance. And then back.
Okay, Vilma, I'm very glad. Okay, number one, Vilma is a absolute wonderful example of why taking PPARS is one of the best choices she can make. So because she has listed polycystic kidney disease, number one. She has listed cholesterol, number two, blood sugar, number three, and psoriasis, number four. She has 4 ailments or diseases that she's having right now. So here's the good news, Vilma. Your soft gel capsule is going to handle all 4 at the same time. Okay, so you don't have to take 4 different drugs, just one. Okay, and I'm gonna give, since this is Simply Nature Answers, I'm gonna give you a bit more technical information about how the product works for all 4. Okay, number one, for cholesterol, it's going to actually improve your cholesterol by raising your HDL, which is your good cholesterol, and then it will lower your LDL. Since yours is only slightly elevated, you should see it normalize with after a month. All right, if you've been taking it for a month, you should see it normalize. Now, your blood sugar is because of developing diabetes type 2. So developing diabetes type 2 means that your cells are not insulin sensitive, or they are becoming less and less sensitive to insulin, which results in your blood sugar being high. Now, since yours is only slightly elevated as well, the good news is after a month, your blood sugar should be normal. All right, it should go down. Okay, the third one is the psoriasis. This is really, really good news. So psoriasis is actually an immunodeficiency. So Ms. Jhen can share her own experience. So my most extreme case of psoriasis that I have seen that's been dealt with is one of our doctora's husband. Okay, she is a doctora who owns a integrative clinic somewhere near Rockwell. So when I met her, I noticed a gentleman sitting in her clinic. He was very reserved and a bit how shall I say, a bit like irritated. Okay, not very friendly. Okay, not very friendly. That's one reason is because his whole body that is visible. That means he was wearing, I think, a short sleeve shirt. So everything from here all the way to his fingertips, it was all flaking. All right, it was all cracked and flaking. His whole face was the same. Obviously, his neck and ears as well. All right, so it was just very, very terrible for him. And I was very excited. So hold on. Since we are here, let me see if I can show this, okay? So everyone, this is good news. All right, I'm going to actually show you something which I normally don't show during our Simply Nature, Simply Healed program. Okay. Okay. Yeah, there we go. We have it here. Okay, am I able to share screen? Yes, I'm able to share screen. Take a look at this. So can you all see this? Sheila and Jhen, is it on your screen?
Yes.
Yes.
Okay. take a look, right? This is psoriasis patient. Look at this. Look, you can notice, look at the ears. All right. Before, after. All right. This is 3 months. 3 months. The patient is taking 60 tablets, PPAR tablets every day.
Oh.
Okay. No drugs. Absolutely no drugs. These are actually patients from the Center of Disease Control from Taiwan. Because like Singapore, psoriasis patient also go to Singapore Center for Disease Control and Skin Center. They are like together. All right. And maybe because a lot of skin diseases are infectious. Okay, so this is considered infectious, but psoriasis is absolutely not infectious. This is an immunodeficiency. So you can see the improvement is amazing, right? Isn't it amazing? All right. So before, after.
It is. It is.
Yeah, it's really, look at this lady's hand at the side, right? You can see for psoriatic patient, it can get very bad, right? It can get very bad. So the amazing thing is this was done with just the tablets alone, 3 months. Okay. So for Vilma, if you're taking this, you're taking soft gels, which is even stronger and better than the tablets for the treatment of psoriasis. I'm looking forward to hearing from you any improvements that you may experience because of this. Okay, so for the doctora, her husband was not taking, he didn't take the soft gel or the tablets, he took the liquid because this was very serious, right? And amazingly, it really helped him to the point that he went to Europe. They were on a 1-month trip. So I think he ran out of the products after 2 weeks, little less than 2 weeks. So he spent 2 weeks in Europe without any tablets, soft gel, or liquid. However, the liquid was so effective that for the remaining 2 weeks that he was in Europe, he didn't have any outbreaks. As a psoriatic patient, you should know, right? Every time you are stressed or you eat new foods, you break out, right? So he didn't break out. So it was not only that his skin condition improved, he also was able to manage his breakouts. Now, does this mean that you will be forever cured of psoriasis? The answer, it depends from patient to patient, but your psoriasis will become under control. That means the next time you eat a little bit of crab or prawn, you will have breakout, but instead of the breakout with lasting days, it may be last only 1 night. And the next morning when you wake up, oh, the redness, the swelling has gone, there's a little bit of redness, but your body has actually recovered. But if you eat prawns every day, then your psoriasis is going to come out, okay? It doesn't mean that taking Simply Nature allows you the license to do whatever you want. You still have to do what is appropriate for your illness. Okay, now can it help with your polycystic kidney? Well, Simply Nature is good for any growth, all right? We don't work on the cyst. We work on the immune system response. So your immune system will then attack the cyst and break it down. So it doesn't matter if you have a benign cyst or tumor or a malignant one, which is cancer, right? It works for both benign and the cancerous. So the mechanism is because your body actually has a way of removing tumors and cysts, and Simply Nature PPAR activates that mechanism. So the good news, Vilma, all 4 things, you will see improvement. I'm very confident, very quickly, within a month, you should be able to see your cholesterol and blood sugar normalize, all right? Psoriasis, you should see vast improvements, if not totally under control. But again, if you take something that you're sensitive to, you will still break out, but you should recover much quicker than before, okay? And for the last one, for the kidney, that one's a bit difficult to share with you exactly what will happen, but there should be improvement, whether small or big, it will depend on your actual condition, okay?
Excellent. Would you like to add anything, Ms. Jhen, quickly?
Yes, I have 2 answers. First, as a pharmacist. Okay, as a pharmacist, for the cholesterol and blood sugar, we already have synthetic kind of PPARs that is for cholesterol. If you've heard it, it's called fenofibrate. Ganyan. And then for the blood sugar, we already have the synthetic pioglitazone. So,
Yes.
So this natural kind of PPARs is really good and beneficial for you, ma'am. Then for the psoriasis, I'll answer this as a fellow patient. Actually, I'm also a psoriatic patient with psoriatic arthritis, but as you can see, as what surgeon said, it can really stabilize. So I actually ate a chicken just now because of Mama Sheila's birthday celebration. Don't tell my husband. But it's good. There's no flare up.
Also,
And
normally
if
in the past, you would flare up from chicken.
yes, sir, immediately I will itch, then I will scratch it, then there's another point, there's another psoriasis spot. Yeah, but
Wow.
my tolerance has gone up. Yeah. And I
Yeah.
only take tablets. I only take tablets, but sometimes I take capsule also when the surgeon gives us lots of projects and we're stressed.
Okay, so to increase my soft gel sales, I just need to stress. Right? All right. No, but not only Jhen, even Sir Louis from Simply Healed Medical Group, he often shares when he talks to doctors that he used to be sensitive to seafood, and that's very common. Anybody who has allergies and skin sensitivity like itch, right? It's always seafood, right? So now he can eat pusit and seafood and he doesn't break out anymore. So that's what he shares every time he talks to the doctors. Yeah. So same. Again, for everyone, what is important for psoriatic patients and any person, in fact, even healthy people, is that you're able to take Simply Nature PPAR tablets regularly for, as your basic supplement for as long as you want to look young and healthy, okay? So those of you, like for example, those who are psoriatic patients, I would just recommend first month on soft gels, right? Why? First month so that you can see the improvements clearly. You can feel the itch and all these inflammation come down. You can see the improvement fast. After that, you can maintain on the tablets. What's important is you keep maintaining on the tablets. The reason is the longer you take the tablets, the more your immune response is actually being modulated, right? It took years to develop your disease. It will also take time for your body to become normal. And as long as you keep taking it, your resistance to outbreak, like what Jhen mentioned, and what Sir Emmer in my company, you will notice that your body is more and more tolerant to these foods. It doesn't trigger you just as easily. So it's important to be able to take the product on a way that you can sustain financially. And the tablets actually is cheaper than some multivitamins. So it's about the same price as taking a multivite. So take it. I've been taking it since I was 27 years old. I'm 51 years old this year. So that means I've been taking it for 24 years. All right. So yeah, I'm the testimony for I hope I don't look 51. Okay, so this is my effect of taking the product for 24 years. Okay.
Thank you, Sir Shyan. Sorry, Miss Jhen. Next birthday, no more chicken.
No. The rest of us eat chicken, huh?
Okay. All right, well, but this is
we
not
will
an
make it special.
encouragement.
Jhen only can eat vegetables. She can sit in a corner with Sir Emma, the vegetable corner.
Yes, sir.
All
But
right.
may I just say, this is not an encouragement for everybody to eat seafoods already, okay? All right.
Yeah.
Okay.
If you are sensitive, moderation, moderation.
Exactly. All right. So we are kind of running out of time. I guess this would be our last question for today. All right. Coming from Miss Dinah Magat. Doc, would PPARS help with the prostate problems? Perhaps you can share about whether it's a prostate enlargement or prostate cancer.
Okay, so I will take the opportunity to answer both, right? Okay. So number one, if it's prostate enlargement, so it's largely due to inflammation, or inflammation will be one part of the role of any enlargement, right? So if you have any part of your body which has swelling, it definitely will involve inflammation. So Simply Nature PPAR tablets and soft gel both work on inflammation very well, right? It helps your body modulate your inflammatory response. So it will reduce chronic inflammation. Okay, so that's one. That's for benign. So I don't know exactly what prostate problem you have. So that's not, it's very vague, okay? I'm just assuming the most simple one is an enlarged prostate, okay? So an enlarged prostate might have other metabolic causes. That means the symptom is your prostate is enlarged, but the cause may be something else, all right? It could be your diet, it could also be affecting your liver and kidneys already, and then it's just manifesting at the prostate level. Okay, so it could be many causes. Regardless of the causes, Simply Nature PPAR tablets is really good for all metabolic syndromes. So it's going to help. Okay. Next, which is appropriate, gel type or tablet? I would say both. Okay. Again, what is important, especially with something chronic, right? A chronic illness is because you may not have identified the actual cause of the illness. So you want to make sure that you can be on it for a long time. So what I would suggest is 1 month of soft gel. Okay, 1 month of soft gel to kickstart everything, because soft gel is more concentrated than the tablet. One soft gel capsule is equal to be about 30 to 40 micro tablets. All right, so you can see you taking one soft gel is like taking 30, 40 micro tablets. Okay, now after the first month, you can decide whether you want to stay on the soft gel or you can go down to just maintaining on the tablets. Again, when it comes to any chronic illnesses, being able to stay on a product for a longer period of time is going to be more beneficial to you, right? For example, if you are diabetic, you can take the extract or even the liquid PPARS. If you take the liquid PPARS, I think within 5 days, your blood sugar level will really improve very drastically, right? But after 5 days, if you don't take the PPARS anymore, your blood sugar will go back up. All right, why? Because it takes time to actually correct your body. Let me give you one simple example. You can go to the gym, right, and exercise until tomorrow all your muscles are so swollen, they look so big and muscular, and they are so painful you cannot move them, right? And then yeah, but you look very muscular and macho because everything is swollen. But it doesn't mean that you're stronger. It doesn't mean you're stronger. To be strong, you actually have to go to gym. You don't have to do the weights so heavy, but you have to be consistent. Maybe after 3 to 6 months, you notice that you used to be able to lift only a 7.5 kilogram for bicep curl. Now you can lift a 10 kilogram, right? Or you can try 15, 12 kilo on the very first day. The muscle will swell up. You look so macho, but the next 4 days, you cannot move your hand. Okay, so what I'm sharing is that when you want to improve your health, like for metabolic syndromes, it's a long-term thing. So it's like if you want to become strong, you don't go to the gym only 1 day and carry the heaviest weights, right? What is more important is that you carry weights moderate, but you are consistent over a longer period of time, you will really become stronger and stronger. So that's the same. So my best recommendation to you is start with the soft gel. Why? You want to be encouraged that, oh, I can see some results. Oh, I feel better. Oh, I can see my blood sugar improve. Then after that, you can go down to the tablets and just maintain and keep on it 6 months, 8 months, 9 months, a year, right? You will not only see the improvement in your metabolic syndrome, you will feel all sorts of wonderful things. Number one, you don't be so tired. Your skin will become smoother because the product helps with cell delineation. So it's like vitamin C. It helps your skin, your new skin becomes smoother and stronger than the old skin, right? So literally, you look at Ms Cheryl, Jhen, and myself. I think maybe one day just to check, we have to take out the filter, or else they say, it's the filter. All right. Okay, so it's not that. Now you also notice that we have a glow in general. The reason is because if you have good nutrition, you will look and feel good. So I think I hope that that helps. Okay, Vilma was yes, please keep us posted, Vilma. I'm very excited for you because you got the best deal, 4 for the price of 1. 4 for the price of 1. You're able to treat everything, and then you don't have to be popping 20, 30 different types of drugs, right? Yeah, so I think that's wonderful. Okay. Yeah, that's it. So start with the gel for some quick results so that you get encouraged. And of course, if your condition is serious, then you want to go for the soft gel. And if your condition is really, really serious, then speak to either Sheila or Jhen or Daisy, and they will be able to recommend you the right product. It could be the powder, it could be the liquid, but usually for metabolics, no. Now for prostate cancer, okay, prostate cancer, good news is that prostate cancer is one of the slowest growing cancer. So that's good news because you have time. If you have time, that means you can use a natural way to treat, as Dr. Joy has shared about some of her patients. So for that, I would definitely recommend you extract powder. The best product actually would be the liquid, but because prostate is slow, you have time. So what you want to do is be able to stay on the product for longer, because the longer you stay on the product, the more your body gets strengthened. I think I saw a question asking about recurrence. This is the last thing I'll make a comment on. Someone asked someone asked about thyroid cancer. When detected early and surgery removed, will people help prevent recurrence and help fully recover? The answer is yes to both. Okay, yes to both. Maybe I can go into greater detail next time we have SNA. But the answer is yes to both. Okay, it will actually help with cell delineation, because you asked what's the cause of anaplastic thyroid cancer. One of the causes is a mutation of your thyroid cells. So Simply Nature PPARS actually helps with cell delineation, which means it prevents the mutation of your. One way to put it, it's not totally accurate, okay, but easy for everyone to understand. It prevents the mutation of your thyroid cells. So in a way, it reduces the factor that causes thyroid cancer. Okay, next, yeah, it will help. So because of that, it will also make sure that the thing doesn't recur. And because Simply Nature PPAR extracts strengthen the immune response. So with a strong immune response, it makes it hard for the cancer to come back. Every time it tries to come back, it gets killed. All right. So that's how you prevent recurrence. And last but not least, will it help you fully recover? Absolutely. Because managing your metabolic, your blood cholesterol, your blood sugar, your liver health, your kidney health, and your gut health, all these that I've listed is very important to how fast and how well you recover from surgery. All right. You notice if your blood sugar is high, they will do something to it before you go into surgery, because high blood sugar prevents clotting. So that affects how your body heals. Okay. So all these things, the answer to your question is yes and yes.
Excellent. Ms. Jhen, before we wrap up and ask, because I will be asking a very quick parting words from Sir Shyan. Would you like to add anything first regarding this question?
I just want to add for Ma'am Vilma Agustin Valdez, another Simple Nature product for the psoriasis is the AD Pro, especially if you have external breakout.
Exactly. Exactly.
Yeah, that's really good. Please look into it, because the AD Pro is also good for cancer patients that are going for radiation therapy. All right, because in radiation therapy, they only recommend you aloe vera, which is a moisturizer and a healing promoter. But AD Pro is actually probiotics for your skin. It will allow your skin to resume its normal bacteria environment, which will protect the skin, moisturize, keep the skin protected, and allow it to heal. So that's a really good tip. Really good tip, Jhen. I totally forgot about it. Yeah.
Exactly. Thank you. Thank you, Ms. Jhen. All right. At this point, well, I'm afraid that this is all the time that we've got today, but don't worry, for those questions that we weren't able to answer, we'll have it answered privately or ask them tomorrow on our Simply Healed webinar. So as we wrap up this afternoon, I'd love to hear your final thoughts to our viewers seeking for 100% natural solution for their cancer and other health problems. Who would like to start first?
Yeah,
okay.
so I'll start, but I think you heard a wonderful sharing by Dr. Joy. It's always very encouraging to hear people who have successfully fought off cancer naturally. Okay, so one thing I want to encourage every one of us is that, yeah, got to be very disciplined, watch what you eat if you're going to treat it naturally. Also keep your options always open in the event that you need any normal medical intervention. All right. So Sheila's own son is a very good example. She wanted to treat Dominic naturally, but because of the aggressive cancer, she had to go for what's that called? chemotherapy. However, here it is. She didn't just chemo and radiation. She didn't just use it. She used natural, conventional and natural at the same time. Right. So I just want to say that yes, we have many success stories with natural, and we are here to support you. But if in the event that you have to go conventional, right, don't be discouraged. The good news is we are also here still to support you, and you'll be able to go through conventional therapy very well with our natural products as well. So they don't conflict. You can get the best of both worlds. All right. So see you guys tomorrow. If you want to hear more, we actually have another program tonight, tomorrow evening. So for those of you who will be attending, I'll see you tomorrow night. So I'll hand the time to Jhen and Sheila.
Thank you, Sir. Ms. Jhen?
As for me, as a fellow patient and also a licensed healthcare professional, we're here to guide you as a client service officer. So we can educate you about PPARS and guide you how to take it. And I know Mama Sheila here has special promotions for you, so stay tuned until the end. And see you tomorrow, guys. Bye.
Very well said. On behalf of our viewers today, I'd like to say thank you, of course, to Ms. Jhen and, of course, Mr. Shyan Lim. See you again tomorrow, sir, for as you answer a lot more questions coming from our viewers. All right. And Ms. Jhen is actually correct, because you are in for a treat, because we have an exciting 3-day after Valentine's promo available only via direct order here from BGC office. So whereas if you buy a box of vials or PPARS liquid extract or a jar of PPARS powder extract, you will get a bottle of PPARS tablet for free. Guys, this is worth 1,850 per bottle. So hurry, because this promo is up until February 21 only. That's this coming Friday. Okay? All right. Well, we also have an exciting news, because on top of our 3-day after Valentine promo, we have an ongoing promos if you order via direct and via website. So you can actually get a discount of 280 pesos off when you buy either PPARS powder or PPARS liquid extract via website. Get 1 free bottle of PPARS tablet when you buy 3 boxes of PPARS liquid extract. That is in our website, the Try Box item there. And also, you can, for our PPARS soft gel capsule users, listen carefully, because you can get a pack of soft gel capsules for 3,700 if you buy 6 packs of PPARS soft gel capsule. All right, now these promos are running up until the end of month or February 28th only. So what are you waiting for? Talk to your assigned client service officers now, because now is always the time, or the best time, to get the best help, not only for yourself, but of course for your whole family. So experience the benefits of PPARS at an unbeatable price. All right, so we hope to see you tomorrow, Thursday. That's February 20, 7:30 p.m. on our regular Simply Health webinar entitled Diabetes and Cancer, Connections and Solutions. All right. So once again, thank you so much, everyone. See you tomorrow. Know that your victories over your health battles, may it be metabolic illnesses or cancer, is what keeps us going here in Simply Nature. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good afternoon, and God bless you all. See you tomorrow.